hour.
We'd know it wasn't you though, wouldn't we, Henry? We'd be thinking that looks a bit like Henry, but it's not Henry because he's sitting
It
really
was what
still.
happened if someone asked me a question or asked something. I was like, that's where I won't get away with it. Like I'll have to suddenly jump across and it'll look really obvious. But honestly, yeah, maybe this is the time for AI me. I need to train an AI actor, and then I can just tap and like answer questions via just typing. Then I could just sit here in like my, I don't know, like bathrobe. Not worried at all. It's um, I honestly, I thought that was spectacular. I can't tell you enough, and I can't the obviously the depth which you've thought about that and presented it. I thought was extremely special. So thank
Thank
you.
you. That's really kind.
Um, right, I've lost my questions. Um, we have had questions, and you have to suffer one from me whilst we start. Once I go and dig them out. Um, if you were actually, I've got a different one. What would you say to young you, like 10-year-old you?
Gosh, that's a tricky one. You mean young me before who didn't know the
Yeah, because
diagnosis?
like,
I think I would just say you'll figure it out eventually. I think kind of don't worry.
which I gave you a worrying moment just then.
Oh, cool. Thought
Where's
he'll come
Henry
back
gone?
when he's ready.
Well, um, that's interesting. You wouldn't tell? You wouldn't say? I feel like if I was put through a portal, I would say, "Hey, by the way, you've got ADHD." If I had like a very limited amount of time, I don't know why I've thought about this, but I definitely have.
Well, I think I'm kind of showing my age here in that I'm very, very nearly 50 in a few weeks' time. And 10-year-old me, there was no knowledge, there was no awareness. So if I was going back 40 years and said you've got ADHD and autism, I don't think that would have helped me in the slightest. I think I probably would have felt worse because what would I have done with that information? I think now, my son is also neurodivergent and there's so much more understanding and awareness, and he goes to a specialist school and they all just talk about it openly, and sometimes we'll do things and he'd say, well, that's the ADHD for you, and there's so much knowledge. But back then, there were other members of my family. I think one of my cousins was probably autistic ADHD as well, and it wasn't called that back then. It was called something really quite rude and unkind, and that was how people approached the difference. So I'm really glad that we live in the time that we do now, and that we're all kind of raising that awareness and making sure that the future 10-year-olds can be told that and know what that means, and know that the support is out there.
That is what we're doing together, which is try and make the world better, this part of the world, this understanding in terms of the neurodivergent part of the world, trying to change it for the better. Like, so I've set out my stall to do that, and I'm doing it with, you're doing it too. We're doing it collectively together, and it's it's a big deal. It's game changing. I think we're at the end of time. We're on perfect time. Conference is running to time, which is amazing, and very, very exciting. I genuinely found that an emotional talk, and I found it because of the amazing way you described the stories and the description, and the eloquence with which you spoke is something else. So thank you.
Oh, thank you very much. It's a pleasure.
Well, yeah, all mine, and thank you for doing this. Thank you for sharing. I have to say goodbye to you. So goodbye. Thank you very much. Thank
you,
you.
Henry. Bye.
by Lisa. And it's, I always feel like I'm about to be my turn shortly at the end of this. We're about to enter our last session, but we're having done this. I think I've been live for, well, the whole thing's 28 hours. I think I've been live personally for 20 hours. Yeah, at the end, you sort of just turn it off and walk off. And it's quite the juxtaposition from talking to everyone. Next up is an extraordinary person. I'm extremely excited about it. It's Tim Kendall, and he's Tim Kendall, CBE, Dr. Tim Kendall. He's a distinguished psychiatrist, leader in UK mental health. There's leaders and there's leaders. And Tim is in the latter. Until late 2023, he served as the National Clinical Director for Mental Health in NHS England, steering national policy and transformation around mental health services. One of the really serious big jobs. He founded and directs the National Collaborating Centre for Mental Health, NCCMH, through which he's developed over 30 NICE mental health guidelines, including chairing the NICE guidelines on ADHD, which was transformational for us and for individuals. It's how we get ADHD assessments. It's the process. It's extraordinarily important. He was awarded a CBE in 2024 for his services to mental health. He continues clinical practice as a consultant psychiatrist, working with homeless populations via Sheffield Health and the Social Health NHS Foundation Trust. He's the chairperson of Care ADHD, leading NHS right to choose provider of ADHD assessments. He's therefore uniquely placed to understand the NHS framework for ADHD assessments and the changes that are happening. Welcome, Tim.
Hi, and thank you very much for inviting me, Henry. I'm very pleased to be here.
I'm like crazy level thrilled. Like it's your yeah, I mean, you are an extraordinary person who's had an extraordinary career and continues to with insights into ADHD and the NHS that no one else has. And you're closing out our global conference, which is, as I think you've just heard, kindly waiting in the wings. We've been live for 28 hours with ADHD Australia taking over for our night. We've had extraordinary speakers from Lisa just now, who talking from lived experience in the heart on ADHD and autism. We've had celebrities like Sam Thompson. We've had entrepreneurs like Ben Branson. The list goes on. So it's been wonderful, and you are signing us out, which I'm very, very excited. So this is an in conversation section. We are talking together, it's which is the point at which I'm supposed to find the questions very smoothly, and I'm getting slightly tripped up. Exciting. Do you want to tell me, like, what does it mean to be the National Clinical Director for Mental Health at NHS England? Because I know how serious the role is, but others might not.
Broadly, you've got two main jobs. One is that you run a program, that you're the clinical director for a program of work. So, for example, perinatal mental health or community mental health teams or whatever. And your job is to help roll those out across the country. And that sounds terribly easy, but actually scaling up is complicated, extremely complicated. And it's often very difficult to know whether you'll be able to actually reliably take an innovation and spread it around the country, and it's still doing the same thing that you started off doing. So that's one half. The other half is that you spend the time advising ministers, mainly in the Department of Health, but you are also expected to provide advice across different government departments. So that might include the Home Office around terrorism and mental health or whatever. It might be number 10. It might be areas like the Foreign Office when you're running a global ministerial summit, or it could be housing and so on. So it's a job which basically don't do it unless you're willing to work 24/7. And I'm very relieved not to be working 24/7 anymore.
Although I think it's been a busy period because you've just come back from a global summit.
I have. I set up the Global Ministerial Summit on Mental Health in 2018, and we brought over about 50 odd countries from around the world came to the summit, including 25 ministerial delegations from all over. And we actually flew over 200 people with lived experience from all over the world. So it was really important that we had such a strong emphasis on bringing people with lived experience and the politicians there. And the whole thing culminated in a meeting which I sort of engineered, and in bringing all the people with lived experience to tell them the recommendations from the global summit, from all the work that happened in 2 days, to tell the politicians what they needed to do. And I can tell you, politicians listen far more to people with lived experience than they do to academics.
We sometimes feel like it's the other way around, but
I know. I think health services.
I think it's together. It's the combo deal that works. Like data and evidence, lived experience for heart, and you obviously brought those two together. You've stopped doing that. What are you doing now?
Well, I'm now National Clinical Lead for New Models of Mental Health Care. So I'm overseeing a set of pilots that will radically change the way that we deliver mental health care. And I think the bit that is really important for this summit, this conference, is that we are aiming for these pilots to be open 24/7 in the middle of their neighborhood of about 40,000 people, and it wouldn't say no to people. So we've had questions. Would you treat people with ADHD? Well, the answer is yes, I would, and I do.
I think one of the hardest aspects right now in terms of mental health care provision is the lack of places to go when there's a crisis. And so we get people contacting us, and in crisis, or actually pre-crisis, where there's just nowhere. Like you're just until and so to hear that kind of plan is coming is a genuinely wonderful thing.
Well,
there's a huge gap.
Fingers crossed that this will be scaled up, and that's always
fair enough.
At the moment the government don't appear to have a whole lot of money, and scaling up something that I think is important for everyone, because we're not going to say there'll be no wrong door. If you come to the centre from your neighbourhood, we will find some way of working with you, and it's working across with the voluntary sector and with social care, local communities, and the whole thing is co-produced with the local community. So it's always asking the local community, what do you want? What do you need? And each local community is different. So I'm doing that, but I'm also chairing, as I think Care ADHD, which is taking more time. And but as a chair, it's got a very circumscribed role, which is to make sure we deliver high quality, low cost services.
And it's a big deal, right? Like the high quality, low price, like is, and working out how to do that, and not being the And I do want to talk to that because actually we obviously run a lot of support groups.
Yeah.
I talk to a lot of people, and actually a lot of the time people are like, my local options are closed to me, particularly if you're outside of England without right to choose. I absolutely do direct people to Care ADHD, and I'm going to say the price because I think it's important, because one of the things that we see is some really high prices, and not only on the front door, it's when people are then, if they're opting for medication, what that looks like. And
Yeah.
I've seen that up to £250 per month just in a consultation fee plus prescription on top. So you're ending up looking at sort of £400 a month, and
Which
it's
is beyond
unaffordable.
a lot of people. A lot of people can't afford that kind of money. I totally agree.
No, and the Care ADHD prices, which I do believe are like one of the lowest, if not the lowest, is a £399 for the assessment, and yeah, medication initiation is £599. It's an important service, and then you're doing right to choose as well. But I think it shows the heart of what you're trying to do, what Care ADHD are doing, which is this focused quality service, but looking at price to make it as accessible to everyone, recognizing that we have a problem. Some people, the NHS is not there.
I should say that my reason for joining Care ADHD from the start was very strongly motivated by, apart from personal ones, I've got 2 of my kids have got ADHD, and it took them a long time to get any service or any help, really. And although I'm pretty sure, when they got diagnosed, and I have to say, I did probably what the usual parent thing is. But what do you mean? They're just like me. You sort of think. So I've got personal reasons, but having done the guideline on it, and having had the chance to really look at what the evidence is. I don't know if you know, but I'm guessing you do know, that actually the evidence behind the treatment in ADHD is really remarkably good. So much so that actually the use of medication, so methylphenidate and lisdexamfetamine, in children, the effect size is about 3 to 4 times as big as almost all the other psychiatric drugs. So it is an incredibly effective intervention. And again, with children, we've got huge amount of evidence around parenting programs, around behavioral interventions, about enhancing those interventions by linking up with the school. So when I was approached by Care ADHD, I know both Mark Pattison and Bobby Pratt well. I've worked with Bobby before. I said I would be chair if for 2 key reasons. One, if we are going for really high quality, nice concordant care, and I can guarantee that, and I would hold them account to that, and that we could demonstrate that we were the lowest cost and a lower cost than the NHS. If we could do both of those, I would be chair. And they both agreed. And it's a great opportunity to do something that I think, I spent 16 years doing NICE guidelines. That's what they are all about. High quality, low cost care. And I think we're proving it can be done. They are a fantastic team, I have to say, but
I've certainly been obviously very impressed by them, having got to know them as well. As I have, onto our questions. I was just struck. So were your children diagnosed before or after you did the ADHD guidelines for NICE?
After, yeah. No, after.
And did you But when you looked at those, there was no epiphany about you. There was once it was brought home that you recognised.
When I did the guideline, I do remember one of the guideline group members, who's an expert in children. She did come up to me and tapped me on the shoulder and said, I mean, I won't say exactly what she said, but it was very funny. I think she said, "You're so fortunate to be very bright because ADHD doesn't work so well if you're not." And I was completely taken aback. It was she'd obviously been looking up close. I sort of guessed that it was quite likely. I share a lot of similarities with my children who have been diagnosed, so it's not a surprise.
Tell us about doing the guidelines, because it was a bigger deal than I think people know, and people know it was a big deal.
Okay, so when we came up to doing the guidelines, I had long conversations with NICE because it was a very contentious diagnosis, and there were a lot of people in the press and in the what I think of as a sort of anti-psychiatric lobby who were saying this was medicating children in particular who were basically naughty children, and there was nothing more to it. And so I spoke with NICE and said I thought it was really important that we looked at the evidence behind the diagnosis. We've never done that in NICE guidance before or since.
Oh wow.
So we had a whole work stream which I personally oversaw. Now, I didn't chair the guideline. I did what I call facilitated the guideline. I chaired the very first NICE guideline and set out the methods, but we have an independent chair. My job is to lead a research team and to facilitate the guideline group. So I helped them work their way through everything. And I had a research team that did all the work for them. And then I'd help the guideline group understand what that research evidence meant, and then how to make recommendations out of it. So we had a work stream on diagnosis, and when we finally produced the guideline, I could stand up and perfectly happily talk about the reality of that diagnosis. And to the shock of some people, I remember in one interview with the press afterwards, where I was asked, well, is it really real? What do you mean? How do you know it's real? What blood test can you do? And I said, well, in diabetes, there is no blood test that proves that you have diabetes, but you can measure blood glucose. And if blood glucose goes above a certain level, we know that that's harmful to people. And in exactly the same way, we can measure people's behavior and experience. And we know that when hyperactivity and impulsivity and inattention reach a certain kind of level, it impairs their function. And they can't, I fail to see how that's different. And I do think that. I think it's one of the things that we can do is we can see what impairments come with those kind of behaviors and experiences. So to go back to your question, Henry, yes, it was a very big deal. It was the biggest deal of any guideline that we've done. So I after we launched it, I spent 3 days continuously in TV studios, radio studios, interviews with journalists from Tokyo all the way over to Los Angeles.
There was worldwide interest.
Absolutely worldwide interest. And we used to produce a hard copy of the full guideline, which is big. Yeah, I mean,